past year has been a unique experience for all of us. We have watched our local communities fall apart, businesses close, and people in small towns struggle to make ends meet. Normally, these situations and needs are drivers and inspiration for our projects, but 2020 was completely different because of an overall feeling of hopelessness. While we successfully shipped over 2,000 items for our female entrepreneurs in Antigua, Guatemala, they had been unable to start their training programs until just a month ago. Even our Hydroponics for Milwaukee program in Escuela View Middle School in the south side of Milwaukee had to be put on hold. But in the midst of all the bad news, a ray of hope started to emerge for our project in fighting preventable blindness. Even during this pandemic, our partnerships, our fundraising, our innovative technology, and our implementation of a sustainable business model in the fight against avoidable blindness has succeeded. We are here to share our progress and our incredible story with you. We welcome you to journey through the looking glass as we present our Project Shakti, transforming lives and providing a vision of hope. But first, let us tell you a little bit about where we come from.
You must be wondering where Whitewater is. We're located in the beautiful state of Wisconsin. Whitewater is a small town with a population of around 14,000 people. We are known for our football teams, our harsh winters, and our absolutely gorgeous spring, summer, and fall. The University of Wisconsin system stands by the Wisconsin idea. Today, that belief permeates the UW system's work, fostering close working relationships within the state, throughout the country, and around the world. At UW-Whitewater, every day we are surrounded by inspiration. Our learning and work environment is all about engagement, and everything we do makes us believe that we can help transform lives. This year, we focused all of our attention on our project to combat preventable blindness.
Over the years, we have worked on various projects to eliminate preventable blindness. As a team, our passion, our purpose, our ikigai, our raison d'etre is the fact that for a mere $25, you can provide a 20-minute cataract surgery that allows a person to see again within 24 hours. In most cases, this immediately transforms the life of the patient and their entire family. It's the easiest outcome to see. No pun intended. Our creative solution incorporates the empowerment of young women as a key part of the solution. Our project this year is a complete focus on addressing the issues of avoidable blindness and transforming the lives of the people impacted by vision impairment in remote regions in India.
There are over 36 million people who are blind in the world, and 273 million have vision impairment issues, which translate to $410 billion lost in productivity annually. In India alone, 9.2 million people are afflicted with blindness, causing $87 billion of productivity loss per year. It is incredibly important to understand that 80% of blindness is preventable. Between cataract surgeries, screenings, providing glasses, and providing medical supplies, we can treat preventable blindness in all ages across the world. Through these treatments, we can not only directly affect the individual's life, but impact their family and their community as well.
We realized that the most impact we can make is to focus on the problem of uncorrected refractive errors. This refers to vision impairment that can be corrected with spectacles. Presbyopia is the most common refractive error. Refractive errors, if uncorrected, results in an impaired quality of life for millions of people worldwide, irrespective of their age, gender, and ethnicity. In the low and middle income countries, ready-made spectacles are inaccessible and unaffordable to the majority of the people with poor vision, especially for those residing in rural areas.
There are approximately 1,280 eye hospitals in India, the second most populous country in the world. This means that each hospital is responsible for approximately 1 million patients. This figure becomes more dire when you consider that in rural India, where 70% of the population lives, the ratio of eye doctors to patients is 1 to 219,000.
The eye care infrastructure, along with the number of professionals, is clearly underdeveloped in India, but this only begins to scratch the surface of the economic problems. The average rural wage in India is only $4.40 per day, while average rural employment sits at a measly 39%. One of the biggest problems can be largely attributed to a lack of educational opportunities for young women in these rural communities. It is important to note that the average daily wage for women in these remote areas is equal to only $2.36, barely above the poverty line. Only 25% of all rural Indian women are employed, and only 54% are actually literate.
We went to work and started to map out a plan that would address the problems we identified. Given the reality of a global pandemic, we had to work closely with our funding partner, Combat Blindness International.
I support Combat Blindness International because I know that the money raised is going directly to helping those that desperately needed help.
And our on-the-ground operations partner, Shroff Charity Eye Care Hospital.
Shroff stood for truthfulness, ethics, and quality care, which we maintain.
Making sure that the patient's interest is always kept paramount.
And also helped onboard a powerful technology partner, SAP, and their ClearVision team to join the project. We named this project Shakti.
Shakti is power, energy, or force in Hindi. Our solution embraced the empowerment of young women to play a key role in our initiative. Let's look at one of their stories from our certified ophthalmic program.
मेरा नाम रेशमा है। मुझे मेडिकल लाइन में जाने का शौक था। आंखों के बारे में काफ़ी नॉलेज हमें मिली। मुझे पता भी नहीं था कि आंखों में इतनी सारी चीज़ें होती हैं। एक एक पार्ट के बारे में मुझे मालूम हुआ। मेरी पहली पोस्टिंग पीएससी में हुई थी, प्री सर्जरी चेकअप में। तो वहाँ पर मैंने ईसीजी, बीपी, शुगर वगैरह ये सब किया था। पेशेंट की हिस्ट्री ली थी और पेशेंट से बात करना सीखा कि आप डॉक्टर से बात कैसे करते हैं।
We recruited 8 women like Reshma for Project Shakti and trained them for 10 days on our technology, as well as medical practices needed to conduct screenings, collect data, and build relationships. The project went live on March 3rd, 2021.
बाबा, हम सहदेवा डॉक्टर श्रॉफ चैरिटी आई हॉस्पिटल से आए हैं। आपके गांव में आंखों की जांच हो रही है फ्री में। ठीक है, आपके घर में जितने भी लोग हैं सबकी जांच होगी। अगर आंख में कोई परेशानी होगी तो हमारा गोला में छोटा चौराहा है ना, सरोज सिनेमा, वहाँ पर हमारा विजन सेंटर है। वहाँ पे आपको भेजेंगे, वहाँ पे भी आपकी जांच फ्री होगी।
And after 15 days, we had conducted over 2,800 screenings, making 531 referrals for surgery, and dispensed 267 spectacles, instantly correcting unforced refractive errors. We were able to get this entire program in place in less than 2 months from planning, recruitment to execution. We trained young women to take charge of their lives by gaining confidence and becoming role models for the younger generation in their communities. And the best part of our business model is the ability to support a living wage for each of them. This transforms lives in the villages, helping people become productive members of society. This approach addresses 5 of the United Nations Sustainable Goals.
While in the communities, Shakti nurses screen community members about vision problems and conduct tests using their mobile phones, using technologies from our partners, and a live dashboard that allows us to monitor and provide instant feedback to the team on the ground. Glasses are dispensed on site, customized, and each nurse carries handheld mirrors in their mobile unit. Because what is the first thing someone wants to do when they put a pair of glasses on? They want to look through a looking glass and see what their face looks like. This immediate gift of sight, of self and of the loved ones, is life-giving and empowering. It is something that the Shakti mobile team can give and are giving daily. In this way, our model generates opportunities for women's empowerment, provides eyesight to those whose entire lives have been impacted by blindness, and makes a dent in the problem of widespread lack of access to eye care in rural India.
Shakti has been well received by all partners and the communities we are starting to impact. There is suddenly a sense of urgency and momentum because we all realize that we have finally found a solution that is truly a game changer. This project not only addresses the issue of preventable blindness in remote places in India and perhaps the world, but also empowers women as a part of the solution and is highly scalable with tremendous return on investment. The best part is the incorporation of a sustainable business model. The overall cost of recruitment, training, and the monthly salary for one young woman is $322. This also includes support and equipment costs.
Our direct revenue is as follows: $1 commission for every referral and each spectacle dispensed. Additionally, each spectacle sold generates 75 cents. The estimated total intake per month is $276 per person. Based on the data from our project dashboard, we have calculated that the break-even point for each person is less than 2 months.
Other revenue streams we are implementing include corporate and private sponsorships, grant funding, and campaigns such as Adopt a Community or Adopt a Shakti Worker. We have validated the first steps towards a sustainable business model. Our global partners are excited by the initial outcomes and have agreed to expand the program by 10 times in the next year. We now have commitments and support from Essilor, the biggest eyeglass maker in the world, to provide 5,000 eyeglasses for free for our next phase of Project Shakti.
Together we can transform lives, inspire future generations to become Shakti workers, perhaps even optometrists, nurses, and entrepreneurs. We have already observed from our previous programs that a percentage of the young women are now even considering going to college. This is your exclusive invitation to join us on our journey towards helping craft a better future. Come with us and take a big, bold step through the looking glass.